I'm laying in bed because I'm having a day, and that's fine. I no longer shame myself for having a day. But anyway, I'm laying here and I'm thinking about a conversation that I had the other day with a family member of a person with suicidal ideation. And this person called me because they got my number from a mutual friend. And they were struggling with their significant other and not understanding some of the thoughts and situations that were occurring in their home based on this person's mental state. And needless to say, part of the conversation that they had with their significant other was that person didn't want to be here anymore. And they were talking about some specifics that would cause alarm to anyone. However, unfortunately, based on the stigmas and the myths that are out there right now, I say right now, really, it's been this way for as long as I can remember, right? So at least a couple of generations now that this misinformation has been out there. Their true belief was that their SO would not unalive themselves because they were talking about it and guilt tripping others with this information. And the conversation had continued down a few different paths, and it became clear that there was a lot of myths and misinformation, in this person's mindset. So I took a moment and I said, I'm just going to stop you here for a moment because it's important to me that as a person in this person's life who clearly wants to support them, right, you should understand a few things. And first off, when someone shares with you their current mental state, it is very difficult for them to do so. It's not something that most people want to share, but they are sharing because we're trying to tell people, reach out, speak up. A life you save might be your own, right? So when a person speaks up to you, you need to cherish that and understand that they're not guilt tripping you or trying to make you feel some kind of way. These are their true and honest feelings. Now, I'm not speaking for the population at large, of course. I have heard of situations where, people maybe did use that as a guilt trip. However, I'm going to go on out on a limb here and say that most people that share that kind of information are not guilt tripping. They are feeling that way. Excuse me. So that's point number one. Point number two is this myth that people that talk about it don't do it. They tell us and they tell us and they tell us. And maybe they tell us in subtle ways or in ways that we don't hear or that are easy to dismiss because everybody has those big feelings sometimes and says things like, oh, right? Don't want to be here anymore. But what if we just listened a little bit harder and took that seriously? Because it has been reported to me multiple times from others that have experienced loss from suicide, and it is my own direct lived experience that they tell us and they tell us and they tell us and they get tired of telling us and they stop telling us. And that's when the risk becomes greatest. Just when you think they're doing okay because they stop talking about it, right? That can be when the risk is the greatest. It's important to have open conversations before, during, and after mental health challenges. That's how we make it okay to talk about it, to get help, to connect with one another. Listen, cherish the things your people say to you. Reach out if you don't know what to do. Thank you so much to that person who called me for reaching out, right? Because together we can try to make a difference. It doesn't mean that this person's out of the woods. We don't have control over that, but we can show up as our best selves and listen with open hearts to someone else's pain and dispel one myth at a time. Thanks for coming to my PSA.